My name is Dr. Karen Bradley, and I'm a veterinarian in Montpelier, Vermont. I own Onion River Animal Hospital, and I've been practicing for 24 years now. I actually went to the University of Georgia Veterinary School, class of 1996, and I did the reverse migration. Most people go from up north down south, and I went from south to north. I can't picture a day that we don't take at least one set of radiographs. And with lots of sick during our busy times, I will say we can take as many as probably 6 to 7 patients a day. Probably our average is 1 to 3 every day. Confidence building is the number one thing. We hear from veterinarians, the number one thing they need is mentorship and support. And I can't always be there. And so, if they're taking an x-ray and it's in the evening and there's not another veterinarian around to look at it, it gives them something it's not a mentor, but it's going to give them a little bit of a pat on the back or confirmation that you're on the right track. Yes, that is an enlarged heart, or yes, that is a mass there associated with the spleen. I'm also recognizing a savings, because when we put that digital x-ray machine in 14 years ago, all or most all of our radiographs read by a radiologist, in order to have us be confident in our diagnosis and see things. We were sending 2/3 to 3/4 of our cases to be read by a radiologist. Probably only half of those did we need to. Had we had so my goal with SignalPET and what I've been trying to figure out, and so far it is proving to be that way, we are sending less cases to be reviewed by the radiologist because we're getting that confirmation and confidence from the SignalPET read, which costs me about 20% of what a radiology read would cost. So that's significant. There's certain conditions we look at and we go, oh, like fluid in the pleural effusion, fluid in the chest, that's really a lot, that patient's critical. We look at it, we go, no brainer. But when it's subtle and there's a little bit and we think it's there, we think the heart's a little bigger, having that pretty quick confirmation that yes, the algorithm agrees with that gives you confidence to then make recommendations to the owner about what we do next with that patient. It does help with when you are a veterinarian either working by yourself or you can't grab your other veterinarian to look at the x-rays. It's a way to kind of get a confirmation for your confidence of am I seeing what I think I'm seeing? So I think that has just helped us with moving on. From all of my practices I know around the country, and the major companies that will read x-rays for you by a radiologist, we have a shortage of radiologists, veterinary and human, and so the time can be days on some of those, what we're getting with SignalPET. The timing of getting that instant read, like within minutes, is pretty impressive. To me, the biggest thing is the value and them seeing the value of what they're getting. So when I run blood work, my lab software lets me email them the results, and the abnormal ones show up in red, and they can see the values that they had last year as a comparison. So the same thing with SignalPET. I can send them the report and I tell them, I'm going to send you this report. You'll get an email. They can look at the pictures themselves. They can see the notes of what was abnormal and normal. And that is really, like I said, it's showing clients the value for that money they spent on those x-rays, which are not inexpensive as far as a diagnostic test. They're seeing the value because I can send them that report. They can open it. They can say, honey, this is what they were showing me on the x-ray at the clinic. I think that's very important. When you're the practice owner and you're looking at things from one perspective, and you're the associate veterinarian who's just trying to do everything right and meeting in the middle, I think this is a way to meet in the middle. And I would definitely highly recommend for people to try it.